Hi, good evening to all. Today the video is somewhat less technical and more of common clinical questions related to the permacath. First, what is this permacath? This is one of the vascular access used for dialysis. More preferred in patient whose fistula was difficult to make in CKD MHD patient whose fistula is difficult to make or in condition where the patient might require dialysis for more than 3 weeks. If you suspect this, we can ask the patient to go ahead with this permacath insertion. And this is how it appears from the heart through the internal jugular vein, and it forms some subcutaneous channel and comes out. Permacath is the trade name, and the technical term we will see. Which vessel can it be placed? The preferred vessel is right-sided internal jugular vein. Apart from this, it can be placed on the left interjugular vein, femoral vein, both right and left side, and very rarely in the inferior vena cava through the translumbar route. Which vessel to be preferred varies from patient to patient. On a standard clinical situation, ideally we prefer the right internal jugular vein. So this is the right internal jugular vein. So this is the entry site. It forms a subcutaneous tunneling and it appears like this. And this is how it is a schematic diagram how the permacath appears. Why not the normal dialysis catheter, which is also called as a simple dialysis catheter? If you say the simple dialysis catheter, it won't be having any subcutaneous tunnel. This is also being placed in internal jugular vein only. This is the entry side and catheter comes out, there will be a plaster over here. The disadvantage of this is it can be kept in situ only for 4 to 6 weeks. Beyond that, there is a high chance of infection because skin, subcutaneous tissue and directly the vessel is entering. So this is the disadvantage. So whenever you are planning for a long-term vascular access, this catheter won't be of much use because again and again you have to change this catheter. Risk of infection is there. If you repeatedly puncture the internal jugular vein, there is a high chance of thrombosis. That's where this permacath comes. If you see the difference between these two, both are in the same vein, but look at the entry side. The entry side is here. After that, subcutaneously, that means below the skin, there will be around 5 to 10 centimeter of subcutaneous area where we form the tunnel, bury this catheter so that the infection won't occur. This is the exit site. It will be covered with skin. The yellow color area will be covered with skin. You can't even see where the entry site is. So the chances of infection from the entry site to the vessel is very, very rare. So that is the most important advantage of this permacath. And what are the other names of this permacath? As I told, it is a trade name. And what is the specific scientific name? It's also called as tunneled cuffed catheter. What is this cuff? Cuff is nothing but inside the subcutaneous tract there is some cuff which keeps the catheter in position. There is a video in the same channel where I have uploaded regarding how to remove the permacath. During that time I have shown the real time cuff how it appears. It just hold the catheter in position. So that is called as cuff. So the name is tunneled cuffed catheter. In some places they say as subcutaneously tunneled cuffed catheter. If you want to say in detail, subcutaneously tunneled cuffed IJV hemodialysis catheter. These are all the short forms which are used. Some places prefer to use this PICC, percutaneously inserted cuffed catheter. So don't get confused with the name or the nomenclature or indicates the same thing. There is a cuff, there is a tunneling and this catheter is being used for dialysis. That's all. What are the advantages of this perm cath? The most important advantage is the duration with which it can be kept inside the body. There is no specific time limit. We have seen cases where a perma cath was functional for more than 5 years and no need to repeatedly change the catheter. If you place the simple normal hemodialysis catheter, after 6 weeks again there is a risk of infection or you have to change it, and because of the repeated insertion there is a chance of thrombosis. Whereas if you take the sperm cath, you insert once, the longevity is there, the patient feels comfortable, and whenever because of the poor veins they are not able to make a fistula for the CKD patient, permacath is the lifeline for those patients because the duration is very long. And this is the second preferred vascular access once the fistula and graft is not an option for a patient because of the poor veins. Another common clinical question, usually from the medicine department, whenever there is a perm cath inserted, patient already a case of CKD, MHD admitted for some other reason. In the periphery, there are no vein. How to give the medication? They always call and ask us, sir, medication can be given through the perm cath or not? Yes, it can be given, but the thing is there is a risk of infection. The nursing staff or paramedic who are going to handle the permacath have to wear a sterile glove, follow the standard sterile precautions to prevent the infection. And after usage, every time they have to give the antibiotic solution inside the permacath so that infection won't occur. This is the benefit, but what is the risk? The catheter costs around 15,000 and the insertion charge varies from 10,000 to 15,000 from center to center. So we are risking that, and the patient lifeline, if the fistula is not made, this is the lifeline. So we are risking the lifeline, we are risking the cost, and the patient vascular access is also at risk of infection. So whenever you are using that as a central line, make sure the sterile precautions is being followed, because we have seen cases where the permacath is being used to give infusions of any antibiotic. The sister might not, or the paramedic staff might not have noticed the importance of this. They might have just flushed it and leave it. The next day, there might be a presence of clot inside. So you have to inform the paramedic or the nursing staff to give the antibiotic with heparin lock solution have to be given in this permacath compulsorily to save it. But answer for this question, does medication can be given or it can be used as a central line? Yes. If the patient admitted, if have no other vascular access or periphery, if there are no veins, you can use this. And this is how the subcutaneous tunnel appears like in real time, and this is the exit site, and the catheter enters the IJV vein somewhere near the neck. And this video is in this channel only, permacath removal. I have posted this video around 2 months back. So if someone want to see how this appears, the cuff appears, you can check out this video. How long it can be kept? The most common question from the attender. How long it can be kept? There is no specific time limit, up 2 years, 2 year, 3 year, 4 year, 5 year. Till there is no issue of infection, till the time patient tolerates it, till the time the flow is good. It depends on the how the patient maintains it and how the dialysis technician or the dialysis team, how they are going to give the care of this catheter. Because after every dialysis, the catheter have to be flushed with the antibiotic and the anticoagulants. Otherwise, the entire catheter might get clotted. There is a risk of infection. And this is how the catheter appears. So probably exit site here, entry site here. So regarding what is the exact site, where to keep the exit site, how to measure it, dust and all, we will see in a separate technical video. Here just simple common clinical questions only I am answering over here. Since the catheter's length might be varying from 90 to 30 centimeter, the amount of gentamicin or any antibiotic solution that we are going to give inside the catheter is very important, because Otherwise, there is a chance of infection inside the catheter, or the patient might throw shivering during dialysis because of the presence of endotoxin inside the catheter, which gets released as the dialysis gets started. So, in simple terms, giving antibiotic along with anticoagulant is must after the dialysis. Most important precaution: whoever is having or any patient on permacath getting dialysis, make sure the dialysis staff make it as a checklist once the dialysis complete, either a standard gentamicin vancomycin as per the recommendation in the particular region along with the heparin, or whichever the anticoagulant is being used, that have to be given compulsorily. That is the most important precautions. So in the x-ray, this is how it appears. Again, in this YouTube channel shorts section, I have uploaded both right side pump cath and left side pump cath. This we usually do after the pump cath incision to look at the position. See, look at the left side pump cath. This is the entry side, this is the subcutaneous tunnel, this is the entry site into the left IJV vein, and this is the exit site where catheters start appearing to your eyes, and from the vessel it goes and sits in the heart. This is the tip. For the right side, I didn't keep the x-ray in this PPT. Probably it might be in the short, you can check out that. And after the insertion, x-ray is required to check the position. And regarding what are the complications can occur during insertion, that and all we will see in the next video. I think I will stop here. So this video is being uploaded after one of my friends asked the questions regarding Perma Cath. So I thought after answering those questions, better to upload a video so that it might be helpful for someone else.